citizen. You have to be 65. You have to be a legal permanent resident of the United States for at least 5 continuous years prior to enrollment. Or you have to have Social Security disability for 4 months, end-stage renal disease beyond dialysis, or ALS or Lou Gehrig's disease, and then you get Medicare right away. Let's see. And as you know, Medicare, if you have any type of health concern, is no impact on your Medicare eligibility. It says other factors affect the cost of Medicare. They have no impact on Medicare. Your current health insurance, employment status, or your FICA contributions. Some man called me one day. He wanted to get back all his Medicare dollars because he didn't need it anymore. I said, no, you don't get it back. All this stuff that they took out of his paycheck for 40 years, because I want that back because I'm going to use the VA. I don't need to use your Medicare. I said, sorry, don't give it back. How would we ever just figure that out? So Medicare enrollment. Automatically enrollment approach 65 if already receiving retirement benefits. I would go on and make sure I would get a Medicare.gov platform, enroll yourself and get your own sign-in. It's a very, very useful tool. Actually, the counselors use that too. Otherwise, you must voluntarily enroll during an official Medicare enrollment period. What is that, right? Initial period. That's 3 months before you're 65 or 3 months after 65, right? If you missed it, you can get in there in the general enrollment period, right? You missed your original enrollment, or there's special enrollment periods, right? Oh my God, it's so confusing, isn't it? So you get, most people delay Social Security retirement benefits till after they're 65. If you're working, right? 65, you get Part A. Always, always, always do that, okay? It doesn't cost you a dime if you work 40 quarters, right? Doesn't cost you a dime. Introduction to Medicare. So this is the initial enrollment period, like we said, right? So if you are 65 in April, you have 3 months ahead to get that, and you get it in April. But if you wait 3 months, you get it the next month, the next month, and the next month. FYI, if your birthday's on the 1st, you get it the month previous, okay? So if your birthday's on the 1st of the month, if your birthday's in April, you'll get it March, okay? Just to let you know, that's how it works. If your birthday's on the 1st. I have a son that's birthday's the 1st. So enrollment in 1, 2, 3 months after 65, effective the following month. And initial enrollment period is 24 months, continuous month. Okay, so we don't need that one. Okay, original Medicare. Medicare A pays the following services which are deemed medically necessary. Inpatient hospital stay, the first 3 pints of blood, skilled nursing, home health services, and hospice care. Now those are home health services that are related to a hospital stay. Okay, home health services that you get from your doctor. You go, I got a gait disturbance, or you had hip surgery, or you're at home and you want home health. That's Part B. Okay, this is only Part A. It's related to a nursing hospital stay. Outpatient services, Part B. That's your doctor's offices, your outpatient medical services. Right, you're going to go to physical therapy, your DME, preventive services. Which are now covered most at 100%. You're going to cover more vaccines this year too, shingles, HB, RSV. So they're going to cover more. And so 20% co-insurance for most services and emergency services. Because we know straight Medicare is an 80-20 plan, right? You'll be responsible for the other 20% if you have straight Medicare. Let's see if I missed anything on this page. Nope. Medicare, that's what I told you about. That's Part B, that's all about Part B. Okay, original Medicare Part A is a fee for service, right? It's an 80-20 plan. You can go to any provider that accepts Medicare, right? Financial assistance available to those who qualify, and the beneficiary course for 2024. So I don't know what that means, but I wanted to tell you about a woman I just talked to. A gentleman his mom had a fall, ended up in Delray Medical Center, and she had her jaw wire shut. But the doctor in the trauma unit that day didn't take any type of insurance. Okay, now not even Medicare. But so we had a problem with that because. So the Medicare, if you don't take Medicare, there's a certain form you have to fill out to opt out of Medicare. You can't just say, I'm not going to take Medicare. So the federal government makes you sign this piece of paper, but this man hadn't signed that piece of paper. And so he wanted her to pay all of its money out of her pocket, going back to get the jaw unwired. So we're helping her file an appeal. Okay, but this is the stuff that, our Shine counselors, especially my Shine counselor that's an attorney, knows all about. So this is the part that Shine counselors can help you with, the ins and outs of that kind of thing. Part A is a premium fee for most people. If you don't have 40 quarters, it is $505 for Part A. Initial benefit deduction is $62.32. This is 2024 numbers. I think it's $16.82 this year. Additional co-pays for other 60 days of inpatient coverage and different costs for Part A services. So that's a little, nuances going on with Part A, right? So as I said, towards it. A benefit period, a spell of illness begins when a person receives Part A covered status and ends with 60 days of covered status. So that's what it means about the 60-day inpatient status. So we know all about that. Okay. Part B, 4% of beneficiaries pay $174.70 for their Part B, right? 96% of actually, this slide is wrong, I've told them 100 times. It means 96% are paying more than that. The annual deductible is $240, I think it's $252 for this year coming up, and 20%. So the other 96% pay more than that. So if you're making a lot more money, you pay more for Part B. I didn't know that until I got this job, and I've been in healthcare in Palm Beach County for 40 years. So, and I worked in nursing homes and, was marketing and sales. I didn't know that. But anyway, so yes, you pay more than that, some people, okay? And we have financial programs, if you're eligible, that we can help you pay for that. So this prescription Medicare, this is like a little synopsis of what goes on. If you have original Medicare, you have to get a prescription drug plan. Original Medicare, you get a Medigap, or you get all three. So this is, or you can get the Medicare Advantage plan. And that's a personal choice, depending on your health care and your health needs. Let's see. It says many here today because they save out-of-pocket expenses for Medicare and prescription drugs, and that's why they go with the managed care plan. Just don't want to miss anything. Okay, supplemental insurances, right? Medigap, supplement, secondary, there's all kinds of names for those, right? So it fills certain original Medicare cost caps, right, that 20%. Now, we all know Medigap is a insurance plan, right, but it's a free agent, right? Those people make their own choices. So we don't have, Medicare manages them, but they have no choice over them. So they have to be approved by CMS as part of Medicare. Most policies accept by a Medicare provider. And there's like A through G on those plans, right? Everyone has a different stipulation. I really recommend if you have your plan for a long time, a Medigap plan, and you're just looking over. So this is the Medigap little summary here. So you can see that they all have to cover 4 certain things, right? They have to cover your copay for A, your copay for B, your first 3 pints of blood, and your hospice care. But then they have other things they might want to cover, right? Whoops. Come on, go back. Did I miss it? There it is. So like you said, Medicare Part A, Part B, the first place in hospice. So then some of them cover your skilled nursing care, right? So they're up to this kind of thing. So every time you go up, you're going to get a higher cost, right? And then look at the bottom one there. It covers foreign travel. I don't know. I just talked to this lady, and she's not going anywhere soon, So let's get that off here. She's not going anywhere. She's not going on any foreign travels. Let's take that off of there. So this is a good way to do an evaluation, review what you have, because high deductible Part F and G options are available, right? So it's the plans are bad. And if you'd like to go, there's a good website we use. It's called the Florida Licensed Insurance Regulation, FLOIR, and that's what we use to manage what we plan for these. The time counselors use that website to help people make those decisions. It's Florida Licensed Insurance Regulation Group. So that's the one that we use. But that's really a helpful little tool there. So make sure you review those and make sure you're on the right plan for you because things change. Medigap eligibility enrollment. Anyone with Medicare Part A and B is eligible. Medigap open enrollment period begins with enrollment in Part B and lasts for 6 months. So guaranteed issue rates cannot be denied or changed due to health conditions, and you can enroll anytime. So this is really critical because, say you going to retire, right? You get Part A, you got Part B, you apply for Part B. You have 6 months to apply for a Medigap plan. If you don't do that, then you'll get a plan, but you might not get the one you want, right? You might get one that's just going to give you, right? So you have to really be careful. So original Medicare pays for health plan services, but doesn't pay for all the health cares. So Medigap policy works with original Medicare, right? So be careful with that because you can get stuck in one you really don't want. So giving me little tidbits here. Let's see, so people under 65 with end-stage renal disease may not be eligible for Medigap insurance until they reach 65. Florida law requires insurance companies to offer Medigap policies to people under age 65 with end-stage renal disease, okay? Anyone with Part A and B are eligible for Medigap. So I had a client that had end-stage renal disease, but the HMO he was on, if they're on an HMO already, they'll keep them, but the HMO wouldn't take them after he got it, okay? So a lot of HMOs won't take them if they have an end-stage renal disease, because it's very costly, right? And people go to dialysis 3 times a week, depending on transportation, and they end up in the hospital a lot, these patients. So don't really want them. Yeah, they can deny them, right? Because they're, free will, right? They don't have to take you, right? So Medicare Advantage plans, right? We got all the tons of Medicare Advantage plans, and you're getting all those calls right now, right? I want to save you $150. Medicare Advantage is a private company, right? So they're private companies, these companies. They have, Medicare.gov does a great time of vetting them, so you really have to look at it. And they're 5 stars, they're 3 stars. So it's a really critical part to look at that. So you have it's an alternative to your original Medicare, and all plans are approved by Medicare, right? They're all looked at intensively. And not all policies are available in all areas, and costs by the company setup can vary, right? So we all know that you have Humana, what do you have down here? Devoted, the Foundation, what is that one? Aetna, United Healthcare, right? You have all those different ones. And that's another thing in Palm Beach County, we have 5 different counties, so like the Indian River one is really not the same as Palm Beach. And then we have patients out in Okeechobee, and there's like one choice there, so, they have to choose, right? And there's no doctors out there either, so you have to really be careful in what you choose, so make sure you get your right doctors. All right, so Medicare Advantage plans cover Part A and B. Must have providers in the plan's network. Must still pay for Part B premium, right? You still got to pay that $174.70, right? Even though you have the Medicare Advantage plan. And that includes prescription, and you may get extra benefits, right? Vision and dental, right? So I was telling Sean, I work for a medical service organization, which is the company that manages the health plan for the physicians. So like I was an intermediary between that. And my job was to go into the doctor's offices and say, Dr. Smith, I really don't want you to use that cardiologist because he's a big expenditures, he overutilizes. I want you to use this guy, So my job was to make sure the health plan, the doctor used the right providers. We had preferred providers, right? We want you to use this vision, this dental, this cardiologist. So my job was to, and don't tell me, the doctor didn't always listen to me. In fact, one day he threw all my stuff right in the garbage. That's why I didn't stay there very long. They were very nice. So I'm telling you, they weren't nice. They were like, yeah, I know what you're saying, but I'm not going to do that, Okay. So depending on specific Advantage plans, members have other costs, right? Additional premiums, co-pays, co-insurance, and other services, right? Because you all have to look at your plan, right? Because some people for therapy, you might have a $15 a day copay. Every time you went, might have $20, $150 for glasses, but it may not give you, might cover vision, but not the frames. So be careful. I was talking to a man yesterday, and he said they covered my frames, but not my lenses. I'm like, how are you going to run around without lenses and glasses? So you really got to be careful. They try to get away with anything, right? And also wellness programs too. A lot of these managed care plans cover wellness too, so you can get down to the gym. So that's managed care, right? We get HMOs, HMO POSs, they don't have those in Florida. PPOs in private and special needs, the SNP plan, those are the people that have, they're dual, they have Medicare, Medicaid, right? They have the dual, their SNP plans, so they have the Medicare Advantage. They have Medicare Advantage. And a lot of those patients, their plans are managed by the Medicaid Advantage plan. So they do that. Prescription drug coverage, that's available to everyone, right? Part D plan for drugs. Coverage is through 2 types of plan options, and people can choose the plan that meet their needs, right? So right now I understand the most economical plan for Part D in 2025 is going to be $45. So that's like the minimum. You're not getting a lot of expensive drugs, it'll be $45. We also have financial extra help. That's called extra help, low income subsidy, or LIS. And those we can help. That's for the Social Security Administration, and the Shine counselors can help you apply for that. and that's, you can get that Part D back. And you say to myself, oh, you know, I got an HMO, I really don't need that because my HMO covers it. But say you do get on expensive medications, right? So you might want to have that. And eligibility right now in Florida, if you, just a round number, if you bring home less than $1,800 a month, you'll be eligible for LIS, okay? And it's a very easy program to get on. It's the easiest. Monthly drugs, copay, so no more than $545 in 2024. I think it's $565. We just came back from leadership meeting and they threw all these numbers at me. So, but we all know Part D is changing, right? What's going on with Part D? So it's a $2,000 maximum expenditure, right? The $2,000. So that's going to be different for us, right? So what they did was they just moved that donut hole from here to over here in the beginning, right? So the donut hole's over here now. So you're still going to have a copay of, like, for first tier. They only have 2 tiers now, went from 3 to 2. And it's going to be $35 now for you, like, if your prescriptions is $0 to $20, and then $200, and $200 to $400 your copay be $45. So they up their copay on how far, you know, the prescription costs. They also have what they call a point of service. So I don't know if everybody knows about that. So if you've got a prescription that's over $600 and you can't afford it, they will put you on payment plans. The pharmacy will do that. I don't understand the stress they're going to be putting the pharmacy under, and what if you don't pay that payment? They haven't figured that out really. So it's still a work in progress. But I do think it's still moving in the right way, right? Because that donut hole was terrible, right? Nobody understood that. So I think it is, and I think more people will pay for their medications now and be able to get their medications. So they just typically just move that hole over the other side. So that's a good one. You know, if you have a managed care plan, it'll just be the same. All right. So this is not pertinent because that's a donut hole one. They haven't fixed our presentations yet. These were given to us by the Department of Elder Affairs. So those are not pertinent. Selecting Medicare coverage. So that's the Medicare.gov site, right? Everybody sees that. You can go on there and you can get Welcome to Medicare. You can log in, find your health plans, find providers, talk to somebody. I think it's an online chat thing. But we use it all the time. In fact, my father-in-law moved to Melbourne and he needed to find a new dermatologist. I just went on there and found him one because there's really great doctors on there. And health plans. So Shine can help you. Financial assistance, just go over this briefly. These are financial assistance programs, like I just said about the low-income subsidy. This is how you get on those. We also can help you apply for what they call MSP and get that $174.70 back. You have to be making less than this year, right this moment. I don't know what's going to happen in January. $1,525, and you can get that MSP. You can get the $174.70 back, and that's gross. You can have a car, you can have a house, you can have $17,000 in the bank. Okay, so get that MSP eligible. And that's managed by the Department of Children and Families. We help you do the assessment, we help you apply for that, but it's managed through DCF. It's very confusing, everyone. Extra help is the low-income subsidy that helps you apply for the Part D. These are the people with low income. You ever hear of ALICE? It's a new term they're using called Asset Limited Income Constrained Employed. So these are people that are working, but still not making enough money, right? That's ALICE. That's a new term they're putting out everywhere. So this is the people that we help that. And some people are still working. Fraud and abuse. Okay, just briefly, fraud and abuse. So abuse provides supplying services or products that are not medically needed. Fraud is intentionally billing, right? So say somebody billed for something recently, right now, urinary catheters are a big thing right now. A lot of people, you need urinary catheters for self-catheterization. They're getting 20 instead of 10. So we can help you with that. You just let us know because we want to know this stuff. Oh, I just got one today. We want to know this stuff because we can see commonalities and things that happen, right? We don't know ABCDME is bilking everybody in Broward County until you tell us, right? And we see it. We elevate that to the state of Florida, and we have monthly calls and make sure everybody's going the right way. So the difference is intent, right? So we want you to prevent, detect, and report Medicare fraud, right? Prevent it. How are we going to do that? Scam artists use Medicare numbers to bill for services and equipment you did not receive or need. check your review, your MSN, right? Check that thing that comes to your EOB, check that please. Make sure it's the right doctor, the right service, the right limit. Report it. Report it to us or report it to 1-800-MEDICARE. So Medicare loses $60 billion a year, right? And if you do get a fraud and abuse on your Medicare card, please get a new card. Call Medicare and get a new card. So treat your Medicare card like a credit card. Don't share your numbers, don't sign things that don't belong to you, and don't rely on advice of others for strangers, and never sign a blank medical form. MSN, I'll just tell you a quick story. When I worked for the MSO, we would tell the doctors to code. You know how you go to the doctors and you get a code, like you've got diabetes, but we always wanted you to code. Hope I'm not telling any secrets. Anybody work for the government here? We want you to code to the high specificity, right? So if you code high, that means the doctor's going to get more money, right? So we want to not only be diabetic, but you want to have some neuropathy to go along with that, right? So this was something we would tell the doctor to do. Yeah, it's crooked, right? And so if you see that happening, call the FTC or local authorities. We had a great research at the leadership meeting. This guy came from FBI and gave us a great thing, and they do some great stuff there, help detecting Medicare fraud. So this is just a thing we want you to look at, right? I want you to make sure it's the right doctor, make sure the right date, make sure it's the right time, and just to take a visual of it, and then you can see whether that really was you. I had a guy that worked in Port St. Lucie, and he got a bunch of bills for a hospital in Connecticut. And I thought, well, maybe he's a sniffer. I don't know, right? It's going back and forth. But one day he's in Port St. Lucie, the next day he's in Connecticut. And I thought, that is crazy. So I called, and somebody was using his Medicare card in Connecticut, his Humana card. And, we don't know if it was intentional or not. He had a very, very common name, so maybe it wasn't intentional. But that new man, the man that was card, now he had all kinds of weird diagnoses, right? So now we had all that guy's stuff too. So now we had all that guy's diagnoses on his chart. Because he had, and the other guy in Connecticut was kind of cuckoo. So, he had all that stuff going on now. Seriously, it was crazy. But then, I'll just let you know, the Humana Fraud Department handled it, and everything went well. So, anyway, this is the things you need to look at here for Medicare fraud and abuse. Okay. I wanted to share with you, because open enrollment is coming, I have a cute little thing here about Medicare marketing violations. So they're calling you, right? They're calling you on your phone. Just to let you know, a plan cannot call or email you if you did not ask them or do so, or if you have no prior relationship with you. So if they're calling you, they shouldn't be calling you unless they know you, unless you've had a prior relationship with them. Visit your home without appointment. They can't visit your home without appointment. They cannot approach you in a parking lot or a mall. They can't approach you unless you approach them first. Sell you a plan or set up sales appointments with you while you're at an educational event. If you share your contact information at this event, this often permits plans to contact you later. So I was at an event last year, and the guy was like, oh, you want to bring this umbrella? Here, sign your name here. Right? So then he has your name. So try not to do that, because then they have legally can call you later and sell you their plan. So just be careful there. That's some things. And if that happens, please report to 1-800-MEDICARE. Because if you do get any type of documentation or they just insistently bother you, please contact Medicare. So it's cute. I have a little cheat sheet here. I really implore you during open enrollment here, annual open enrollment, to review your plan, because plans change, right? Every year their plan changes, and you don't know what you have, because that H1036 that you had the co-pays may change. Doctors may change, right? Because your Dr. Smith that you absolutely love didn't hook up again with Humana this year. So be careful with that one, because it does change. Because what happens is they just, the contract isn't right, so they don't sign up again for Humana. And you might have a wonderful doctor that you really like. So the annual notice of coverages. Remember, premiums, deductibles, and copay may increase, okay? Review your plan. Counselors or counsel provide personal assistance at counseling sites. I know about here. I'm sorry to tell you that I don't know where they do counseling in person here, but I'm sure they do it on phone. Counsels will look for ways to save you money and find the best coverage for you, right? They're going to go in there. They're going to look at what your medications are, where you live, what doctors you see, and they can really decide where you are and which. I had a man that saved this guy on the Medigap like $8,000, his counselor. He was so excited. I saved this man $8,000. I'm like, my God. And remember, we are confidential and secure, right? We can help you with the savings programs also, help you save you some money there, because we can save you money all around, right? And these counselors, they absolutely love to counsel. This is their thing. You know, these volunteers are great, and I always say, you know, it's not like walking dogs and pecking kitties. It's a lot more than that. And if you have a passion for helping people, we'd love to be a volunteer. And I'm sure Marlene, who's the Shine liaison here in this county, would love to help you do that. And so, what else? And open enrollment. I implore you to review your plan, and please make sure you do that. And call your doctor and make sure your doctor's on that plan. Don't just look on the website and take that for law. Please call because it does. They don't update those things very well sometimes, right? So I don't really have anything else. I'm sorry. I'm sorry. That's about it. Let's see. I think that's.
Here comes Sean.
That's it.
For questions.
We're done. Thank you. Okay, that's on there. I did bring some of those flyers here regarding open enrollment and understanding Medicare Advantage and Medicare Plan enrollment periods. Oh, I do want to mention that there is a special enrollment period if you have a managed care plan. I call it, oops, I made a mistake, special enrollment period. Say in this annual enrollment period you choose Aetna, right? And then January 1 comes and your doctor's not at Aetna. You can still make a change from January 1 to March 31st. Okay, so say you made a mistake, you got the wrong plan, and it's not the one you like, and you can still change, because if you're on an Advantage plan, you can change to another Advantage plan between January 1st and March 31st. All right, so if you did make that mistake and you don't like the plan, or you want to switch back to Medicare, you can do that too. Okay, you can't go the other way though. You can only go that way. Okay. Here's the question.
Questions?
Thank you so much. Great presentation.
A lot of information,
All
right?
right, so now we're going to go ahead and do questions here in just a moment. I just want to point out to you, you should have been given a survey when you came in. If you can go ahead and start completing that for us while we do the question and answer session, because we love to have your feedback, and it helps us do a better job next time. So please fill that out and leave that with us on the table here before you go. So we're going to go ahead and do what we can to get through your questions here. So I see a gentleman here with a hand up. I'll go to you. Just raise your hand, and I'll get to you, and we'll go ahead and take your questions.
What's the difference between an HMO and a PPO?
Okay. So a health maintenance organization or a preferred provider organization. HMO is mainly, the difference is you need referrals, right? You need referrals for HMOs, right? And usually the preferred provider is more restricted. You don't have the option. PPOs, you can go to any doctor you want, right? You might have a bigger copay, but you can go to any doctor you want in a PPO. But HMO, now I know the true train of thought right now is they want the patients, the HMO patients and the PPO patients to use the same doctors. So they are pushing you, the HMO physicians, to use the same providers because it just keeps their network smaller, right? Plus the HMO use more cost-effective, like that word, cost-effective providers. So they want you to use that, they want you to use the provider. But I always recommend people, if you're deciding whether you want to go to a managed care plan, start with the PPO. Get your feet wet first. Don't jump in the HMO because you're not going to like it. If you go right from the original Medicare to an HMO, and the restriction you're going to have on you is really going to be tough. So go to the PPO first and try it out and see if you can manage being, keeping your network small, right? And the doctors want you to go. The HMO doctor really wants you to see him or her, them, for all your needs. They don't tend to want to send you to a specialist, right? They want to keep it all in-house, right? Okay.
I'm going to do a way in the back here next.
Okay.
And then we'll get back up in the front. Here we go.
Yeah, I wanted to ask you, I am on disability, and I just got a letter from my insurance provider.
Mhm.
I have a PPO Medicare, and then it said that that is no longer going to be offered as of January 1, and that I qualify for a Medigap plan. My question to you is, do you know the price? I know that I'm looking at a Medigap G, and if you're 65, I think they're going to offer it for $276 starting January. Do I qualify for that price since I'm only
Because
56?
you're younger.
Yes.
I don't know for sure, but see, this is the typical advantage, right? The PPO is not going to be provided anymore.
No longer.
Right? So this is not why you really need to review your plans. I don't really know. I'd have to research it, and that's where a Shine counselor can really help you. Get a Shine appointment. Yeah, I don't know. Offhand.
This gentleman right here.
Yeah, hi. I was told there would be Shine representatives here to make appointments with you.
And maybe they had initially said that, but
That was the incentive for me to actually come.
Oh, okay. Well, you can call them, I have the Shine flyers are here, and the PSA 10 numbers are here. You can call them in the morning. PSA 10 is 954-745-9779. I
Do you have a pen?
can bring that over.
The
Help mine.
800 number is insufficient. Do you have a phone number?
Yeah, here's the Broward number, PSA 10. Yes, I do.
We have plenty up there, so before you leave, go ahead and grab one.
I got pens.
I can speak from experience. When I work with Social Security, we refer people to Shine. It's very easy. You call the local number, the 954 number. They have multiple locations in Broward County, and you can get it. Some of them do walk-ins, some of them you can get a scheduled appointment, and they'll do a one-on-one consultation with you based on your drugs, the medicines you take, whatever your personal situation is. They can help you out to help you pick the best plan.
They're really great. All the counselors are wonderful, and I met a couple that came to leadership. That's how involved they are, the people and the counselors in Broward. Wonderful.
Hi, I'm going to be turning 65 in a few months. However, I'm currently on my partner's family plan. So how does that work when I hit that plateau?
Okay, so you're gonna sign up for Part A, definitely, right? Part A. And you don't really, if you're gonna stay on that plan, you don't need B yet, because you're gonna stay on that plan. So the rule of thumb is when you have your own insurance plan and you are Medicare, if you work for someone that has less than 20 employees, your Medicare is primary. But if you if your insurance is more than that, your Medicare is secondary. But definitely sign up for B. And I don't know if you can, that you have, once your partner retires and you're off his her plan, you have 8 months. You have 8 months to apply for Part B. You should do it sooner than that.
How can I find out whether it's cost beneficial either way?
If it's what?
Let's say I want to see what it's going to cost if I get off that and I go straight to Medicare.
Yeah, it'll be the $174.70, the Part B. That's what you're gonna have to pay for. Yeah, and Part D, which is about $45 this year. So you'll have to pay just that. It might be more cost effective that way. It might be.
Can I ask if you get currently get Social Security benefits? Have you got no?
No.
Okay. Yeah, so like she said, contact Social Security, get the Part A, but like she was saying, you don't need to get in Part B if you're covered under a group health plan based on your spouse's insurance. You can enroll later on in a special enrollment period.
Yeah.
Well, yes.
You have to make sure it's credible coverage later on.
Question here. So starting in 2025, there's a $2,000 per year cap on out-of-pocket drug costs for people in the Medicare prescription drug plan. So the question is, do the monthly premiums paid under the Medicare prescription drug plan count toward that $2,000 out-of-pocket drug cost per year? Or does it apply only to the cost paid for the actual drugs themselves?
No, it doesn't cover, it only covers the cost of the drugs themselves, the $2,000.
Right.
That's only the cost of the drugs themselves, not the premium. Not the premium, doesn't cost, doesn't count, no. It's very, very confusing. We don't even know that, I've been to a couple in-services and we're still not even sure how it works. It's crazy.
So I know that you can move from Medicare to an Advantage plan during open enrollment. But let's say you want to switch back from an Advantage plan to Part B. Is there a penalty?
Not during the special enrollment period during the Oops, I Made a Mistake plan, January 1 to March 31st. There's no copay, no penalty.
Let's say you take the Advantage plan for a year,
Mm-hmm.
and then you decide, I hate this, I want to go back to Medicare.
During annual open enrollment that's coming up, you can
It's
switch.
still okay.
Mhm.
All right, very good, thank you.
Manage to Medicare, to straight Medicare. Mm-hmm. Yes. You can get, you may not get the one that you like, but
Wait.
you can get another plan, a Medigap plan.
Wait for the mic, please.
Yeah, please, thank you. All right, go ahead, sir.
So I'm trying to rush to retire. I'm 60 now, and I don't know whether I want to go and claim Social Security at 65, 67. And I, unfortunately, I may live okay, but I take some very expensive medications. I don't pay that much because I have one medication that they have a card for, and it covers my deductible, which is about $8,000 on a gold plan. I don't pay for the rest of the year. My question is, what plan do I need to, what ideally exactly going to cost? I need to know how much money I need to have aside to cover these medications so that I may never be able to retire, unfortunately, but I don't know that.
That's a lot of questions.
Yes, it is. That was the main reason for coming here. I had no idea, and I've gone online and I have.
You know, we have to be 65 to get Medicare when disabled, right? Unless you're
Correct.
24 years.
Yeah, I got no issue now, it's just later on what happens.
You know, I'm sorry, I can't really tell you what's gonna happen in 5 years when you get Medicare. Things change. Things are gonna be better though with these new costs, the new drugs that from the Inflation Reduction Act that's coming out next year, 2026, they'll have those 10 more drugs that are covered and 10 more drugs that are covered. So I think it's gonna be great. I really can't tell you that.
My partner has had Medicaid for several years. And this year, when the renewal came out, he was 4 days late reapplying, and they turned him down flat. Is there any recourse?
Yes, it's called the Florida Justice Health Project, and if you didn't get Medicaid, they can help you. It's called the Florida Health Justice Project. People that you think get Medicaid and they get denied, they do great things.
Florida
Health Justice Project.
Thank you.
I refer a lot of people there, and I actually met them, and they're really nice people, and they help Medicaid. And I don't help people with Medicare, only Medicaid.
All right. Got a gentleman here.
On the Part D, are those going to be priced based on the medications you take?
Yes, it's a percentage. What do you mean, the premiums?
Yes.
Yes, those premiums are based on the medication you take.
Okay, so if you take medication that's $5,000 a month,
It's gonna be higher, the premium will be higher.
probably super high.
Mm-hmm.
Like what?
I don't know, it could be $200 or $300, I don't know. It's not gonna be crazy, no. It's not gonna be crazy. I've never heard any more than 400. But make sure you get the right, the right plan. Go on the Medicare.gov, put your meds in there, and do a compare and contrast.
I have two things.
Sure.
One, where does long-term care come into this? And the second one is, who can I talk to before the changes happen for 2025 for Medicare? I don't want to wait till January 1.
You can talk right now to a Shine counselor. They're just booking open enrollment appointments now because we just got the plans ourselves. It just got published on Medicare.gov because we were waiting for them ourselves. But call and get an appointment for a Shine counselor. You can do it just do it over the phone.
That's the number.
What about the long-term
There you
care?
go. They'll help you with that too.
Okay.
Yeah, long-term financial planning, they're very good. When you call the helpline, I know in Palm Beach, when I call the helpline, make sure you tell them that's what you want, because certain counselors are better at certain things, so you might even need 2 appointments for that. That's a lot to ask.
Thank you.
I'm still unsure about the differences between advantage and supplemental, and your comment got the, oops, I made a mistake, I want to change.
Mhm.
I was under the impression that you can't change your supplemental choice plan if you decide that you don't want that.
No, you can't once you make that. I'm talking about a managed care plan. So if you, annual enrollment, if you signed up for a managed care plan and you decide you don't like it, you can switch to another managed care plan.
So managed care.
To managed care.
Is that what they call Advantage?
Advantage.
Advantage.
Yeah, managed care advantage plan.
Okay.
Yeah,
So-
same thing. Or Part C, they call it Part C,
Right, so if you pick supplemental instead of Advantage, you're stuck with whom you picked originally enrolled?
You are stuck, yes, for the next annual open enrollment. Mm-hmm, till next year.
Okay, okay,
Yeah, for the next year. Then you can change again.
okay.
Can you do the reverse?
Sure.
I'm 65 and I actually have my Medicare Part A card,
Mhm.
but I don't have a Medicare account. Do I need one? I'm on company insurance.
Well, I mean, I think I'd get a Medicare.gov account, just so you have it, and you can find doctors there and different providers. God forbid you end up in, they need skilled nursing or home health, you can find providers that are Medicare providers, because that makes, good sense. I was just talking about that lady, she got in trouble, another lady I was helping, she's on the 4th level appeal, because they told her she didn't choose a Medicare dentist. Well, there's no Medicare dentist on that, So they won't pay her bill for her traumatic trauma and her jaw wired shut because there's no Medicare. She didn't choose a Medicare dentist. Well, there isn't any. $7,000. This poor lady, she's got all this bill. Mm-hmm. Yeah, that's it, sir.
All right, let's get a question over here real quick. We also have people passing out some of the handouts as well.
Oh, thank you.
Just for clarity, participation by medical is at the doctor level, not the practice level, and not the hospital level?
For what?
Are you looking, if you go to a doctor, are you looking for that doctor to be part of the
Yes,
HMO
you're looking for
system?
that personal
Doesn't matter,
physician.
But some of the ones in the practice can and can't.
Correct.
Some of the people in the hospital
You're looking
can
for the
and
specific
can't.
doctor
It's at the
because.
specific doctor level.
Yeah, because the insurance plan is to that doctor. They sign it, because when I worked with Humana, the doctor would be the doctor, not the practice, the
Or the
physician.
hospital.
Or the hospital. And that's what I was so disappointed with that man at Delray Medical Center. Why would they let a doctor be on staff that doesn't take Medicare? It's ridiculous. The poor people, this makes sense. He takes nothing, only private pay. So now he wired this lady's jaw shut, and then she has to, who's going to unwire it? She's like held hostage, to get her jaw unwired shut. The poor son is like, she's going to have to sell some jewelry to get her jaw unwired shut.
We can assume though that like Broward Health and Holy Cross and that, as hospitals, they're part of Medicare.
Right, you could assume that, but then the physician might not be part of Medicare.
Right, okay.
Mhm. The only way I'm going to get him is because he didn't opt out of Medicare. I'm going to get him.
Thank you.
And me neither. I work for Jupiter Medical Center Physician Relations. We vetted those doctors incessantly. We made sure they took, insurances. And still, say you go to the hospital and you break your hip and the doctor doesn't take your insurance. That doctor's still responsible for your aftercare, even though he didn't, because he was on call when you broke your hip. Makes no sense to me.
We have a question
It's
over
just
here.
bad business, bad practice.
Yes, sir.
Let's say you go to a hospital for surgery, can you demand only people who are in your provider care to service you, so you don't end up with that
Yeah,
problem?
if it's an not emergent situation, yes. My husband he fell through a dock and broke his knee, and the orthopedic on call was not what I liked. I'm like, no, don't touch him. I need this doctor over here. So you can choose what doctor you want, absolutely. Be your own advocate. You can choose your doctor, absolutely. I wouldn't, if I don't like that either. I'm not super keen on their medical skills.
So we can do a couple more if there's anybody else who might have any. Anybody else? So looks like we're pretty good. I want to thank
Thank
Bea
you.
again very much for
I
coming
wish I
here.
had
Thank you for the
specific
great information.
That's a really great great idea, we should have people that make appointments and lectures.
Yeah, please come up here and get some of the literature, because you can schedule a one-on-one appointment with a Shine counselor, and they can go over, whatever your personal circumstances are, to help you out with the medical choices. Thank you.